is Jane Robinson, and I'm here to present my speech, my persuasive speech. My topic is breast cancer, early breast examination. My general purpose is to persuade. My specific purpose is to persuade my audience to perform regular breast examination. My thesis, I will discuss the importance of breast examination for early detection of breast cancer. Jane Ugo remembers precisely the first time the thought of surgery as a cure for fear. And she remembers that the idea of having her breasts removed, yes, her perfectly healthy breasts, it struck her as a simple solution to an urgent worry and a profound sweet relief. I had never heard of such a thing before, but I thought, gosh, doesn't that make sense? Let's get rid of them. Let's put a breast implant and let's never think about this again. How many of us in this audience have thought about that? Now, breast cancer is something that all women think about. Even if a few of us go as far as contemplating mastectomy in the name of prevention. We think about the disease when we hear when we hear of the predictions have been revised. When we think about breast cancer, when we hear a friend is dying, or a sister, a mother, or a friend of our friend has been diagnosed. Barbara Wan, as the executive director of San Francisco-based Breast Cancer Action, says that if patients were to be polled about their tumors, how they were picked up, about a third of them would say self-exam revealed it. Breast cancer is a disease that affects both men and women, and therefore breast self-examination is recommended for both men and women. Breast cancer is the most frequently diagnosed form of cancer other than skin cancer among women in the United States, and the second leading cause of death. This year alone, it is estimated that about 207,000 American women will be diagnosed with breast cancer, and nearly 40,000 of them will die from this disease. Breast cancer in men. Most recent American Cancer Society estimates that the male figures about 2,190 new cases of invisible breast cancer will be diagnosed among men, and about 410 of these men will die from breast cancer. The prognosis or the outlook for men with breast cancer was once thought to be worse than that of women, but recent studies have found this to be not true. In fact, men and women with the same stage of breast cancer have a fairly similar outlook for survival. The National Cancer Institute estimates that about one out of every 8 women will be diagnosed with breast cancer at some stage in their life. But the good news is that mammograms, which is the X-ray picture of the breast, can detect breast cancer as early when it is most curable. Despite statistics, breast cancer is no longer viewed as a death sentence. When breast cancer is detected early enough, it can be treated and it is curable. According to the Center of Disease Control, CDC, a mammogram can show a lump at an average of about 3 years before a woman can actually feel it. Mammograms are the best tools for early detection. According to Ms. Marsha Henderson, Health Program Director of the Food and Drug Administration Office for Women, early detection gives a woman more treatment options and a better chance for success with treatment and survival. Magnetic resonance imaging, which is MRI scans for women who are diagnosed with cancer, detects about 90% of cancer in the other breast, which probably was missed by mammogram, according to the new study. Given the established rate of mammogram and clinical breast examination for detection of breast cancer on the opposite or the collateral breast. Adding an MRI scan to the diagnostic evaluation effectively doubles the number of cancer and immediately found in women. Effectiveness of the MRIs and the diagnostic of breast cancer is noted. In conclusion, I would urge every woman who is over 40 and you cannot remember the last time that you had a mammogram, then you may be overdue. The National Cancer Institute estimates that 1 in every 8 women will be diagnosed with breast cancer at some time in their life. But the good news is that mammogram can detect breast cancer only when it's most treatable. So I would therefore urge all women in this room and anybody listening to me, if you can go back, start our breast self-examination. It doesn't take long, it's just a few minutes. Or even do your annual mammogram. That would help us prevent breast cancer. Thank you very much. Thank you for listening to me.